And in this podcast, we will discuss TMS and treatment resistant depression. Depression is a worldwide problem. More than 1 billion people suffer from depression. In US alone, we have more than 44 million people suffering from depression, with a incident of 18.3% and a lifetime incident of about 29%. Depression is not just mere feeling sadness and depression and being helpless and hopeless. The patient not only suffer from sad mood, depression, feeling of helplessness, hopelessness, guilt, sleep issues. It has a negative impact on their health. The patient's medical conditions become hard to control, and they also feel frustrated as the antidepressant medications, not all the time, help them achieve a response or a remission. Some of patients are not able to tolerate antidepressant due to side effects, including sexual side effect, weight gain, upset stomach, nausea. A TRD, which we call treatment-resistant depression, is any depression in which a person has not responded or have a more than 50% decrease in their depressive symptoms with 2 or more antidepressant. And when we look into treatment resistant depression and its treatment, I usually tell my patient is one of the treatment modality you can do is treatment as usual, which will be adding more medication and doing psychotherapy. And today we are going to talk about TMS. TMS is a transcranial magnetic stimulation therapy. And what is TMS? TMS is a non-invasive brain stimulation technique that uses a magnetic pulse to a targeted area, which is left dorsolateral prefrontal cortex. And I tell my patient is if each neuron is a tree and there is a group of neurons sitting in your left dorsolateral prefrontal cortex, that group of tree, which controls your happiness and that circuit, is withering away. And the jungle says this group of trees doesn't need nutrition, so it takes the fertilization and the water supply away from it. TMS start to stimulate this group of neurons, and when they become active, the brain started to divert, increase blood flow, the synapses get more dense, the glucose utilizations increases, and it is an effective treatment for depression. There are a lot of evidence which has shown TMS to be more effective. They did one study in which they look into if we switch to a SNRI or add an augmentation with aripiprazole and do a TMS augmentation. In that study, they found TMS patients were able to have a response, and about 52% patients had a response with TMS versus 35% with aripiprazole and 32% with switching a antidepressant. So TMS is not a sham, and some people also describe as when you are interacting with people and every day there is a brain activity going on. If you have a cardiac rhythm which is not synchronizing, you started to feel fatigued and tired, and that's when you will have pacemaker or cardiac defibrillator who gets your cardiac rhythm in sync. Think about TMS, that since you are not in sync with the world around you, like when a good song is happening, you're not able to enjoy. Think like when people around you are happy, their happiness does not last. You are not in that moment. What TMS does is it does synchronize your brain activity to the world around you. So you are being able to achieve what you want to achieve and achieve and a response. Response is, as I mentioned, is defined as a 50% reduction in your depressive symptoms. In our practice, use BrainsWay TMS machine. BrainsWay TMS has been approved for OCD treatment, treatment-resistant depression, anxious depression. We also do smoking cessation treatment with TMS. Let's look into how TMS is scheduled. TMS is about 36 session, and we do one session per day, up to 4 to 5 sessions per week. So we do 30 sessions like that, and the last 6 sessions we taper off to 3, 2, and 1. Each session is about 30 minutes. The active stimulation happens for 2 seconds, off for 20, on for 2, and off for 20 seconds, and goes on about 20 minutes. There are some side effects to TMS. I tell my patient TMS is not a comfortable treatment. You have some discomfort during the treatment. Acute pain is not normal. It's like a magnetic stimulation happening on your scalp. So you will have some scalp irritation, some twitchy eyes, some teeth chattering. Some patient will wear mouth guard during the treatment. Some patient have mild headache. One of the questions I usually been asked is, if I have migraine headache, can I get TMS? So I tell my patient, I've been doing TMS since 2018, and we found uh, patients with migraine headache, either their migraine headache improves, two, they are able to tolerate migraine headache with TMS. A lot of our patients also report, even though their migraine headache is getting worse, they are still getting a lot of good response and they want to continue. Some patients too want to discontinue TMS. In those patients, we are able to reduce the threshold and see the incidence of migraine headache and severe headache goes down. There is a risk of seizures, especially if you drink too much a night before, or you do not get a good night's sleep and have less than 4 hours of sleep, or you have uh, taken too much of medication, or you miss your medication, or there's a change of medication, can increase the risk of seizures. We do ask safety questions, and if we feel there's a increased risk of seizures, then we don't do the TMS on that particular day and we schedule you. It is very safe. We do not have any seizure-like activities. TMS is now being covered by more and more insurances. A lot of commercial insurances has relaxed their policies. I want to share some stories from my own practice. One of the patients which come to my mind is a 77-year-old female. She came to me for depression, hypersomnia, cognitive decline, has already failed 2 or more antidepressant, has failed psychotherapy, and she is an artist and has dropped her artistic activities for more than 2 years. She had 36 treatment, and what we found, her slump score improved from 18 to 25, which was showing cognitive decline because of the depression, and has been to normal for her age. And also she started to feel normal, and she reported, I didn't know this is how normal felt for a long time. She started to pick up her drawings and paintings, has a very good response to TMS when other treatment failed. If you or your loved one are suffering from severe depression, I would encourage you to talk to your provider